going to be seeing in the scientific meeting, which is along my expectations, are some of the long-term safety data about some of the CGRP monoclonal antibodies. So Arenumab, for example, has 2-year safety data from one of their studies of refractory patients who are harder to treat, and they're looking at 2 years, how did these patients do? And I'm excited to see if they did well year 1, do they continue to do well? Because patients ask us this all the time. Other things that we're going to see is some of the data on FOCUS, which is fremonizumab long-term safety studies. We're also, fremonizumab is being looked at for cardiovascular safety. They did a small trial, and I'm really interested to see those results because, again, I just mentioned Arenumab has this label update that has to do with hypertension. So we just want to know, is this specific to the receptor? Is it any chance we're picking up a signal in the ligand, CGRP monoclonal antibody? So I'm interested to see how that's going to play out. Yeah, so when we think about these, it's very hard. What do you call them? They're therapeutic, but they're not medication. So I always call them the non-medication therapeutic options. They can be lifestyle, behavioral management, devices, neuromodulation. And you know, it's okay for the neuromodulation devices to take a year off. That has been up and running since way before any of these other medications. And I think that they are some devices that are under development right now. So it'll be interesting to see what that data looks like in the next couple of years. When we're focusing in on behavioral treatments, you know, it's as if the timing couldn't have been perfect, but of course these studies were being done long before. There's been a little bit of a shift in how do we bring these things to patients without them having to find a therapist. This is a big problem. So there's a couple of small studies taking a look at telehealth for occupational therapy for headache, apps that are being used for different types of behavioral feedback modulation. So an example is they're looking at an app for progressive muscle relaxation as a treatment option in patients with migraine. This is amazing. I mean, this is what we need anyway, but what timing? Patients definitely don't want to come into clinic. And so to have some data points about how this works without actually being seen, I'm really looking forward to seeing that. And I really think that's the next wave. I mean, if anything, having apps that really focus in on behavioral techniques, we've had some already. We have Calm and Headspace. These are great additions to be able to tell your patients about. And I'm not endorsing either company. These are just the ones that I tell my patients about. It's the ones that I know the most, and our patients love them. It helps them sleep at night. It reminds them to breathe during the day. It gives them some short activities they can do in the middle of their workday when they're really stressed. It allows them to take a moment away from the computer and stretch and breathe and not be stuck in the, you know, the day-to-day grind that I think definitely starts to build on their migraines, and they don't have to go and see somebody. So it's probably the easiest tool to have.